Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode on the Health Trip Podcast. Every day, we hear more and more about the importance of gut health and how it relates to all chronic disease states, such as cancer, Alzheimer's disease, cardiovascular disease, and type 2 diabetes. No one aims to get sick, but our conventional healthcare system is not well-versed in preventive approaches to our overall health, especially when it comes to gut health. More often than not, the doctors we are seeing are not asking us about the foods we're eating or not eating, our level of daily stress, sleep, or exercise routine, all of which play a huge role in our gut health. Poor gut health can now be scientifically tied to poor mental health, low libido, weight gain, hair loss, disrupted sleep, and so much more. Layer on top of that the menopause transition that all women will go through. Menopause already opens the door to those 4 chronic disease states I previously mentioned, but is now showing in new research that it plays an adverse role in our gut health. So the first lines of defense are lifestyle interventions and getting our gut health in order. There is no better guest to have on to speak about gut health than my guest today. Kiran Krishnan is a research microbiologist and a health and wellness expert who aims to make complex information understandable to all. He has founded a number of successful health and supplement companies over the last 15 years, including co-founding and leading Microbiome Labs, the preeminent microbiome therapeutics-focused brand among healthcare professionals. He has conducted and published several research studies in scientific journals and has published chapters in scientific textbooks, reference books, and has global patents. He is a sought-after speaker on human health and the microbiome. My medical disclaimer before we dive in: by listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any of my guests on my podcast. So sit back, open your mind, and let's dive in to gut health and women's health. Hi, Karan. Welcome to the Health Trip Podcast. So happy to have you here today.
Hi, Jill. It's great to be with you. Thanks for having me.
Yeah, I had the pleasure of meeting you in person after using your products for over 8 or 10 years. So it was really nice to meet you a couple months ago when you talked about the gut-brain axis outside of Chicago.
Yeah, it was that was a great meeting, by the way.
Yeah, it was.
And such a relevant topic. So I was very happy that you were able to make it.
I also love being there and meeting other health coaches because so many times, it's not that we're left out intentionally, but we're just becoming more important, more part of the equation for people's overall health and wellness. So I'm glad to be part of that population, to be included in some of these conferences.
Yeah, I agree. And I think one of the really important roles that health coaches play is that accountability portion.
Yeah.
Because there's often a communication disconnect between the individual and their doctor, and a lot of times that's an hour spent together, right? And sometimes longer, sometimes less. And then it's up to the individual themselves to make the changes and stay with the regimens and so on, which we all know is really hard to do. And
it is really hard.
And it's often leads to a compliance issue, and then lack of results. Then lack of results brings confidence issue and loss of hope, and then you just switch to a different doctor.
Absolutely.
Right. And then without that coach is part of the program, you really lose that accountability component of it.
Well said. Could not agree more. With that being said, let's jump into your love of being a microbiologist.
Yeah. It's so my brain is wired in such a way that I'm constantly on the prowl for the unknown and the new things, right? And it's not about like the shiny new thing. It's about innovation. Where can I utilize my capabilities to try to drive innovation, try to drive discovery, and then of course through that process be able to educate people about it, which is one of the most exciting parts of all of it, right? Knowledge is absolutely meaningless unless you share it and you utilize it in a way that really impacts people. And so I actually had one of two areas that I would have gone in. It would have been in the world of quantum mechanics and physics of the small things, which is very similar to microbiology in a way where there exists a universe that we can't see but impacts us on a daily basis, right? In every way, shape, or form that we function, it impacts us. So that's the whole quantum world of atomic and subatomic particles. And then there's the microbial world of this invisible universe that is in us, on us, all around us, that impacts us. And we knew very little about it, especially as it related to health. So for me, the microbiology side worked better because it had the biggest relevance to human health and clinical applications. And my mom is a medical doctor, and my dad was a microelectronics engineer. So I got a little bit of both, right? So my mom is a
Hmm.
great clinician, very empathetic, an amazing systems biology thinker. She's trained as an allopath, but I've actually done a number of clinical trials with her with her patients with a number of products. So she's like, it's really kind of opened up her eyes on things. My dad was a microelectronics engineer, so he worked in the world of physics and engineering, and he had over 200 US patents in his name. So he was an innovator. He thought of a lot of things and he invented a lot of things. So I think I got a mix of both. And I think microbiome and microbiology services my drive and needs really well.
Yeah, I heard you once talk about that, how the microbiome, with all of its diversity, is very similar to outer space. And I thought that was such a cool analogy because it really makes a lot of sense when you think about it.
Yeah. Well, number one, like outer space, there's been an evolution over the course
Hmm.
of time, right? There are all of these natural forces at play that cause the formation of planets and suns and stellar objects, and how galaxies are formed and how they influence one another and so on. And it's just a matter of time, and then the natural order of things start to fall into place. It's the same thing with the microbiome, right? Our microbiome as humans didn't evolve overnight or over a few hundred years. It evolved over millions of years in conjunction with us, right? So as our physiology was evolving, so were the microbes that govern that physiology. And it's a really elegant natural order of things because it's this complex ecosystem that has all of these thousands upon thousands of variables, and all of it has to work together in concert for this construct of the human system to function properly. And that's why it's really exciting, because then when you start thinking about disease and disease process, which can seem really complicated, which can seem really daunting, which can also seem like just bad luck, right? The prevailing thought, I think, up until about 5, 7 years ago, is that most diseases were a function of bad luck. Like, oh, you
Yeah.
just got MS. Oh, it's so too bad you got cancer. Oh, you just have the worst luck with this kind of stuff. Like, people just thought it was just a freak of nature thing that happened. But now we know all of those things that are seemingly incurable, like cancers and neurodegenerative conditions like Alzheimer's, Parkinson's, MS, all of these types of conditions, of course, heart disease and other things that were known to be lifestyle. All of those things involve the microbiome in some way and involve the functioning of this ecosystem, right? And so it's really interesting to start to understand, and we're just at the tip of the iceberg. Start to understand like the connections between all of these things, connecting all those dots.
Yeah, we're going to connect some really important dots between the menopausal transition and women's health and gut health. But before that, I think we should define what the gut microbiome is. I know this is super easy for you to define, but very complicated because a lot of people, by the time someone comes to me, you'll be surprised to know that a lot of people think the gut microbiome is just the stomach and what's in the stomach. And it's
Right.
so much more than that.
It is. It really is. And we can also, define two terms that people may hear. One is microbiome, and the other is microbiota.
Hmm.
Right? And you'll hear them kind of being used somewhat interchangeably, but they have different meanings. So microbiome is really the totality of organisms and all of their genetic elements. So often the microbiome is referring to the bacteria, the viruses, the fungus, the protozoas, or whatever may exist in that environment, in the ecosystem. Typically they're talking about the whole system, which is a human being, and then all of their genetic elements, so all of the genes that come along with the microbes. So that whole encompassing ecosystem is called the microbiome. Now, when you get very specific into like the gut, the small bowel, the large bowel, or the stomach, or the mouth, very specific components, then when you refer to the microbes in those components, you often use the word microbiota. So even though we say the gut microbiome, you can kind of say that because the gut microbiome is so big. Normally, microbiome is referred to as the whole thing, which is the entire system. And then more accurately, you would say gut microbiota. So what's going on in the gut microbiota, right? What's happening with that population? But for the purposes of our conversation, we'll use them interchangeably so that people understand that. The other thing that's really important to note with the microbiome is you've got more microbes in your system than human cells, right? The numbers debated. It used to be 10 times more. Now it's about 1.5 to 2 times more. No matter what, it's more, right? We have more microbial cells than human cells in our system. What is not debated is that we have at least 150 times more microbial DNA in our system than human DNA, right? So for those that are listening who may not be familiar, remember DNA are genes. They're the things that code for proteins and other things that will actually do the work in the body, right? Genes are simply just the code. Genes don't actually do anything except hold a code. The genes have to be translated into proteins, and then the proteins go on to do all of the function. They become enzymes, and they become hormones, they become all kinds of stuff, right? So our DNA, the belief was our DNA is what we use to conduct our function as a human. And then we started doing this thing called the Human Genome Project, where we're trying to map out the human DNA to understand what all the genes are. And then the other hope was that we'd find a gene for every disease, right? That there's a heart disease gene, there's a diabetes gene, there's this, a cancer gene of some sort. And so the idea was that, okay, maybe we can affect the progression of these disease states by impacting the gene or gene expression. Now, they sequenced the entire human genome and they said, okay, there's a huge problem here. And the problem is that they figured out there's about 22,000 functional genes in the human genome. And that might sound like a lot if you're not familiar with genes, but there's almost 30,000 functional genes in an earthworm, right? So we are far less sophisticated than even an earthworm in terms of the volume of genetic code in this highly complex system, right? So it left a big gap because then it was like, well, how do we function? How do we do the things we do? We do not have enough code to conduct functionality, right? And that's just for people to really understand that it's like, the computers that run everything, they have lots and lots of lines of codes, and there are lots of microchips that contain codes in it. Imagine, you have a computer that's a supercomputer, and you open it up and you look in it, and there's one little microchip in there with like 50 lines of code. That is similar to like your old TI-85 calculator, right? That some of us used in high school, depending on when you went to high school. It would really be confusing. Like, how in the world does this supercomputer do everything it does? Well, then you start to discover that the microbiome includes genetic material from microbes. And as it turns out, we utilize millions of genes from these microbes in order to conduct basic function. And so the microbiome encompasses that component of it. And there's about 150 times more microbial DNA in our body than human DNA. And so it goes way beyond the stomach, goes way beyond the intestines, way beyond anything that's looking at it at an individual component of the body. It's really the totality of your system. is this microbial soup complex ecosystem with all the genes.
And it's the only part of our body that is exposed to the outside world.
Yeah, I mean it's the key part of the body that adapts to the outside world, right? So it's the part that dictates how your body responds to the world around you, right? So for example, if I could eat something, right? And then you could eat the same thing and you might have a really bad reaction to it and I might be just fine, whether it's an infection, whether it's an allergic response and so on, right? So then the question is, okay, why would one person respond
Mhm.
this way and the other person be totally fine? That is a function of the microbiome and how well your microbiome is adapted to training your system to tolerate or deal with that new food, right? And the same thing occurs with changing geographies, moving to a different environment, dealing with other things you come in contact with, chemicals and all that we're under contact with all the time, all the different things that are found in our food and our water supply and all of that. So your body's adaptability and resilience is a very important marker because resilience marks how well your body tolerates negative stimuli, right?
Mhm.
And we cannot exist without negative stimuli. We just the world doesn't exist that way, right? So then how your body deals with negative stimuli will dictate how quickly you age, how quickly you break down, how easily you get sick, how vulnerable your systems are, and so on. All of those things are controlled by how the microbiome allows your body to respond. And that's going to sound weird to some people, right? Because I'm talking about our body and I'm talking about the microbiome. And I just said how the microbiome allows your body to respond. Well, as it turns out, a lot of the ability of your immune system, for example, to respond to the world around you comes from the microbiome dictating to the immune system what it should react to, what it shouldn't react to, how it should react to things, and so on. Because it's the microbes that become the eyes and ears of a lot of the internal processes in your body, right? And that may be part of this issue of having limited genes, right? Our immune cells are born with limited knowledge because we barely have enough genes to make immune cells, let alone feed them with knowledge about the world around us. And of course, the world around us can change from time to time, right? As you move from New York to LA or from LA to North
Mhm.
Dakota, right? Wherever you go, there's a different environment, different stimuli,
Mhm.
different antigens, different types of food, different negative stimuli. Your body has to adapt to all of those things. And it's your microbes with their massive treasure trove of genetic capability that allows you to respond to those things appropriately. If you don't have the right microbes, then they're not working with your system. They're, in fact, most of the time working against your system. And that's where disease comes from,
That is so fascinating.
right? It's
So, yeah,
we've given
mind blowing.
control, yeah, a lot to
Yep.
microbes. And it wasn't, and even though I say that we gave control, it wasn't a conscious decision in that the human biology was like, we're just going to have them do this, right? This is how we evolved. We are part of the ecosystem, right? So I talked about having lots and lots of microbes, right? So we have, something like 20, 30 trillion microbial cells in our system. And of course, millions of genes versus our tens of thousands of genes and maybe about a trillion or so human cells. Our cells and our system is part of that ecosystem. We are just one part of it. And even though we think of ourselves as being the big part of it, because we're physically the big part, we can see ourselves, we can't see the individual microbes. We're no larger than the individual microbes that make up the ecosystem, right? And so we function because that ecosystem exists. If that ecosystem did not exist, we would cease to function. You can see this in studies with something called no biotic mice. No biotic mice are mice that are raised with no microbiome at all.
Hmm.
They're raised in a completely sterile environment. So when they're first born, they're born in a sterile environment, and then they're hit with lots of antibiotics to basically kill off any microbes in their system. And then they're continuously raised in very, very, very sterile environments. Now, they have certain basic functionality. They can eat food, they can breathe air, they can do some of the, they can poop to a certain degree and all that, but they don't live very long at all. right? They can live sometimes as little as weeks because their immune system doesn't function at all. Their hormone balance is completely off. Their metabolic system's completely screwed up. Everything's just kind of screwed up in them because they don't have a microbiome. And yet they have all their genes, all their cells, all their own DNA. When you don't have the microbiome component, you have no ecosystem and you can't function.
So ultimately, we want our microbiome to be very diverse, like a rainforest, right? Just full of the good and full of the bad, right? They have to live harmoniously together. And when people end up taking a lot of medications, such as antibiotics, or maybe their lifestyle interventions that we touched on earlier, are not in line with living a healthy lifestyle, this diversity then goes down. And there's some very important other functions of the gut microbes, such as extracting nutrients from healthy food that we eat, synthesizing vitamins and minerals. Talk a little bit about that, because when your microbiome is not a rainforest and it's more of a desert, it can't do these jobs. And then we start to see on the outside, I think it's easier for non-medical people to notice the changes going on outside of their body, to then start to have a light bulb moment and think, oh, something's going on underneath the hood. Things such as hair loss, which I experienced for 20, 25 years on and off. Skin issues, eczema, psoriasis, acne, weight gain. So all of these symptoms are representing a larger issue going on, starting in what it sounds like our gut microbiome.
Yeah. So all the things you mentioned are basically basic functions in our body dismantling because our ecosystem no longer supports them. Right. And keep in mind, for us to have hair, for us to have normal skin, for us to have grow nails properly, break down food and assimilate the nutrients, and then, detoxify the food and poop it out. All of those basic functions, right? And maintain leanness and maintain muscle strength and density and all of that stuff. All of those are basic biological functions, right? Those aren't superhuman capabilities. Those are very basic biological functions. But those basic functions require, as we touched on earlier, this ecosystem that's balanced, diverse, utilizing and providing genetics and all kinds of other capabilities just to maintain basic function. And so once that ecosystem starts to become compromised, as you say, it loses diversity, which means it loses functionality. Then those parts of the body start to fall apart, and then you see it as aging skin, loss of hair, losing vision, clarity in vision fast, teeth rotting, gum disease, autoimmune conditions. Your immune system is going haywire, right? So now you've got allergies to things that you never had. You've got sensitivities to foods that you used to be able to eat just fine, right? Pain in places like joint pain and, back pain and all of these things, loss of strength, loss of energy, all of these things is just the basic systems dismantling, right? So we think about ourselves as a house. As a house gets older and if it's not maintained, then things start to fall apart, right? You start getting mold growing in one area, the plumbing starts leaking, the toilet doesn't flush anymore, some of the lights don't come on, not all the outlets work, right? Those are just a slow dismantling of the system, right? So even though we see these things as like seemingly unrelated, some people may not see hair loss with low and having like low energy and brain fog is like related at all. They're like, oh, I have these two separate problems. I've got this thing happening on my scalp, and at the same time, I've got a thing happening, just in my gut or my body. I just feel low. All of those things are connected. So let's talk about for a moment what happens to food, right? Let's educate people on what happens to food as it goes through your system and what the microbiome does for the food, right? So you're chewing your food. Now, one of the first things that happens is food is a big source of danger as well, right? Because lots of bad stuff can come in with the food. You can get contaminated food, so you can get lots of microbes like viruses, bacteria, and yeast and so on coming in with the food. So you need protection from the food, from the potentially bad things in the food. That starts in your mouth itself, in your saliva, which has enzymes and all to start breaking down the food. You also produce something called secretory IgA, which is an immunoglobulin that helps neutralize all kinds of potentially bad things in the food. the production of that IgA is determined by microbe stimulation in the gut, in the immune tissue in the gut. So your microbiome is starting to protect you from the very first bite by increasing your production of secretory IgA, so you can neutralize anything that's potentially bad and harmful coming in with the food, right? So then you swallow the food goes down into the stomach. Of course, the stomach releases stomach acid and all that. Now, the microbes in the stomach have to be balanced. If you have an overgrowth of microbes like H. pylori, for example, which would be an imbalance of microbes and a dysfunction to the diversity in the gut, in the stomach, then you start to reduce stomach acid production, right? So H. pylori, that's one of the things it does, is it reduces stomach acid production and it makes the stomach less acidic, which is a key way in which the stomach functions, is through the acidity, which means that then the food you put in doesn't get adequately acidified and broken down. So the first step in digestion occurs in the stomach. The stomach acid cuts up proteins and carbohydrates and chops big things into much littler things. It dismantles these complex folding of protein. So it's a long string of protein instead of this really complex three-dimensional structure. All of it so that when it goes into the small intestine, you have a better shot at chopping it all up with enzymes and then and absorbing it, right? So a healthy stomach with a healthy stomach microbiome affords all of those functions. If your stomach is dysbiotic, then you're not going to produce enough acid. You're going to get lots of stagnation in the stomach when you eat. It's going to feel like it's just sitting there like a rock forever. You feel full very quickly. You might even produce a lot of gas because the stomach acid is not low enough where it's going to prevent the fermentation of food in the stomach. So now you might get gas and gas pain and what we call gastritis, right? Which is kind of a inflammation and a bloating out of the gas of the stomach. And so now you might feel full, bloated, uncomfortable. You might be burping. You might even have reflux from all of that, right? So all of that is just because you've got an imbalance of microbes in the stomach. So then move to the intestines. Intestines, we secrete some of our own digestive enzymes, but we're really bad at secreting digestive enzymes, right? The amount of digestive enzymes we naturally make declines with age relatively quickly, especially once you hit 30 and above. And then we don't also make enough complex enzymes to break down all the complexity of food. And so we get an assist from the microbes in the system. Some of those microbes in the small bowel will produce some digestive enzymes to help us break down the protein adequately or the carbohydrates or the fats so that we can absorb the nutrient components of these things into our system through the small intestine, right? Now, if we don't have adequate microbes in the small intestine, we have a dysfunction in the diversity and we have problematic microbes, not only will you not get to break down the food effectively and assimilate the nutrients, but they will likely ferment the food in the small bowel and create more noxious things like ammonia gas, for example, right? So now you get really severe bloating and gas and discomfort. In fact, some of that gas and discomfort and all can disrupt how the small intestine moves. And so you might get a lot of cramping and IBS-like symptomology, right? You'll get a lot of inflammation in the lining of the small bowel, which makes it leaky. And then that means every time you eat food, you get a huge dose of toxins that move through the leaky intestines into your circulatory system that causes inflammation throughout the body, right? That damages the brain, it damages lots of organ systems, it causes a suppression of your immune system, all of these issues, and it becomes the foundation of most chronic illnesses, right? All of this just because you have the wrong microbes in the small bowel, right? And then the food moves into the large bowel. Whatever food we didn't break down and absorb, like fibers and things like that, will move to the large bowel. In the large bowel, what's supposed to happen is lots of groups of microbes ferment them and produce really important compounds for our functionality. So I'll just give you two examples. One is urolithins. Urolithins are these amazing compounds that help to repair our mitochondria, which are the little engines in our cells, right? And the most well-defined theory of aging centers around dysfunctional mitochondria, right? So poor aging and loss of functionality in different parts of the body comes about because the little engines in the cell start to die off. And if the engines die, the cells die, and then the organs that the cell makes up will start to die as well. Along that death process, you also get what we call morbidity, which is a reduction in the functionality of that organ, right? So this is one of the things that happens in the eyes, for example, which is why lots of people, need glasses, right? I mean, most adults need glasses of some sort. Most kids nowadays need glasses or contacts and all that. And that's because your eyes have a lot of mitochondria because they're absorbing photons and producing all these things. So they need energy, a lot of energy, right? And the mitochondria get disrupted in the eyes to the point where the eye cells aren't functioning the way they should. So your vision becomes less and less over time. That's why you need to correct it more and more, right? Same thing with your gums, same thing with your skin. As the skin cells become dysfunctional and aren't able to replicate and replace, then your skin no longer looks youthful. You start getting fine lines and wrinkles and dehydration. Same thing with the roots, in your hair, right? The follicles in the hair become inflamed and dysfunctional and can't repair adequately enough, so they start shrinking the width of the hair protein. And so that's an indication of that root slowly dying and losing dysfunction, driven by dysfunction, right? So the hair shaft that it makes becomes thinner and thinner and thinner. Eventually it just dies off. Same thing with everything else, right? Erectile dysfunction, everything, muscle loss, everything in the body. Once the mitochondria dies, then the cell that the mitochondria sits and dies, and then the organ that the cell makes up starts to die. All of that occurs at an accelerated pace because we're not making urolithins in the large bowel if we don't have the right microbes, right? The other ones are short chain fatty acids. Short chain fatty acids are really important for your entire metabolic process, right? We've all heard about these GLP-1 agonists that are really popular right now, right? Ozempic and all that. And in general, the data is really positive around these in terms of like weight loss and controlling blood sugar and reducing cardiovascular disease and all that. All of that works because it's activating a receptor in the gut that produces this protein called GLP-1, glucagon-like peptide, right? The microbiome produces key compounds like butyrate and so on that upregulate that same peptide, right? The drug is basically mimicking what a healthy microbiome would do. And this is why some people gain weight, have metabolic syndrome, end up with diabetes and all that, because they don't have the microbes, the adequate microbes in the large bowel to control all of those systems. The people that don't gain weight, that tend to be lean, that tend to have good muscle mass, tend to not develop diabetes and all that, happen to have the bright microbes in the system that do the natural GLP-1 activation. And so if you don't have the right microbes in your large bowel, once food moves in there, you're not producing the right compounds, you're not activating the right receptors, you're not producing things like the urolithin to repair the system, right? You're not producing enough serotonin, you're not producing enough dopamine, you're not producing enough vitamins. All of these things start to falter, right? So your body becomes starved of all of these basic nutrients. And then eventually, also because your colon is probably messed up if you don't have the right microbes, you don't form stools well, and they don't pass in a regular interval, right? So that you might be someone that's constipated more often than not. Or you tend to have lots of loose stool. You might only go to the bathroom once every 2 or 3 days, or you might go to the bathroom too frequently. And all of that, again, is because of a microbial disruption. Right. So hopefully what that illustrated for people is, what is the role of the microbiome as you go through the digestive tract and you swallow food, and what are some of the things it does for you, and where, if you have a dysfunctional microbiome, what are some of the results of having that, right? So someone who has a dysfunctional microbiome starting in the stomach, small intestine, and large bowel, what they may end up looking like is every time they eat, they get really bloated and distended in the stomach, right? They might have reflux disease. And then once the food moves into the smaller bowel, they might get a lot of distension, a lot of discomfort. That might produce inflammation throughout the body. So they might have eczema, they might have psoriasis as a result of that. They might have fungal overgrowth as a result of that. So you could end up with alopecia areata. And then when food moves to the large bowel, you have a disruption of the production of these critical mechanisms. So you might feel very tired, you might have neurodegeneration, your muscles weaken, your organs weaken, you might have eyesight issues, you might sleep in a dysfunctional way. All of these things start to fall apart. And then your digestive system feels really unhealthy as well. You're not going to the bowels, you're not moving your bowels regularly and so on. So hopefully that made sense to illustrate for people that, simple imbalances within the microbiome can lead to these profound issues that we see as disease states, right? But they're not. They're actually just simple ecological imbalances that can be corrected.
You left out hot flashes, but basically you described menopause.
Yeah. Well, and let's talk about hot flashes for a second, right? I mean, the microbiome plays a really important role in hormone balancing because hormones are detoxed through the gut, right? Your body produces a hormone, utilizes it, but then has to get rid of it, right? Because hormone levels are highly controlled in the body. And one of the key ways in which your body gets rid of hormones, take estrogen, for example, is it goes to the liver, right? As it circulates through the body, it dumps into the gut. And then from the gut, it goes through portal circulation into the liver. The liver conjugates it, which means that it's neutralizing the estrogen. So it no longer functions like estrogen in the body. That cloaked, neutralized version of estrogen is sent back out to the gut to be defecated, right? And if you have good functional microbes, that's what happens. If you have dysfunctional microbes, when that conjugated estrogen goes back into the gut, one of the things that these dysfunctional microbes can do is deconjugate it, meaning removing the cloak and making it active estrogen again. And then estrogen gets reabsorbed into the system. And then now you start to have this issue of estrogen dominance, which pre-menopause, a lot of women may suffer from that estrogen dominance. That is the main hormone dysfunction that a lot of women suffer from, right? And that can lead to things like polycystic ovarian issues, of course, lots of weight issues, emotional issues, higher risk of breast cancer, all of these things, right? And then you get to your perimenopause and menopausal states, where then all of a sudden you get this massive cliff dive of estrogen. And now your system's not functioning the way it should, and your body doesn't know how to make enough and recycle it properly and so on. So you end up with all of these other dysfunctions. And progesterone and all of the other hormones are also, in one way or the other, worked through the gut. And if the gut is not healthy and diverse, you're going to end up with hormone imbalances in the system.
So in regards to the estradiol or the estrogen recirculating, you're talking about the estrobolome, which is a series of bacterial strain that is associated with the estrogen cycle. Is that a good way to describe it?
It is, yeah. In its most basic function, a good functioning estrobolome, which is that constellation of microbes that play a role in estrogen, the most functional way is that they help detoxify your body of estrogen.
Right.
And there's some evidence that some of the detoxification or the byproducts of those microbes metabolizing estrogen can actually have other benefits. It can impact your vaginal microbiome, for example, in a good way, right? So that is a very critical part of it. And if you have low estrobolome or dysfunctional estrobolome, then you miss that very critical step in the whole estrogen recycling.
I want to talk about stress during menopause. And I don't know if it's stress on top of the menopause or the menopause transition is layered on top of the stress, but it is a very stressful time for a lot of women. I'm in my mid 50s and can attest to that. And it can attest to all of the hormonal changes and how it's influenced my gut. And I've had to redirect my lifestyle to rebalance my gut health. Right? I have to eat differently. I can't eat like I was in my 20s and 30s. I have to manage my stress differently. I have to exercise differently, and I have to prioritize my sleep, all of these things. And they all do help me manage my daily stress. But stress is one of the biggest influencers on our gut health.
It is. In fact, there was a 2015 publication in Frontiers of Immunology that showed, and this is what we call a meta-analysis paper, right? Meta-analysis paper just means it's a study that is a publication that's based on reviewing lots of studies on the topic. So it's almost like coming to a scientific consensus on a topic. And so the meta-analysis evaluation of this basically showed that stress-induced leaky gut was the number one cause of mortality and morbidity worldwide, right? So it's the number one killer of humans worldwide. Stress-induced damage to the gut, which leads to leakiness in the gut, and then it leads to chronic low-grade inflammation because all this stuff is leaking through. So then absolutely, right? As a first step, stress induces a dysfunction in your digestive tract. And the reason for that, and there's a couple of different reasons, but one main reason is because there are lots of microbes in your system that are considered to be opportunistic. And what that means is that they're really good at looking for an opportunity where the system is unstable. And then that's when they choose to really express their virulence factors and their growth factors and try to grow, right? So there's a lot of problematic microbes that have that opportunistic component. And one of the key things that these microbes have learned over time is that they can measure stress hormones in the host. And if the stress hormones are elevated, that's when they know that the immune system and other defense mechanisms are down or compromised to a certain degree. And because of that, they go, hey, this is our opportunity to take over. And so they start expressing their toxins and virulence factors and growing quickly. So as you keep experiencing stress, you get more and more dysbiosis. It's like taking an antibiotic and creating a disruption in the gut. Right. So then that disruption that you feel from the stressor is actually amplified because you're changing the microbial environment as a result of experiencing stress. But here's the kicker of it. Those microbes that grow better under those conditions and start to, increase their population, their numbers, those microbes also induce more stress in the host. And why is that? Well, because they want to keep the system unstable, right? That's a better environment for them. So it becomes a self-perpetuating cycle, right? You experience a stressor, it causes disruption in your ecosystem. That disruption actually makes it easier for you to feel stress. That stress you feel easier now causes more disruption. The disruption further makes it easier for you to feel stress. And over time, what happens is people's tolerance lowers, right? Things that may not have bothered them in the past now become a big bother to them now. Our thresholds and our tolerances go down, right? We get short with people. We have this concept of just having a bad day, woke up on the wrong side of the bed, right? All of these kind of sayings that we have colloquially for like just describing this low tolerance that we tend to have that day. That's all just a function of the microbiome basically diverting your ability to manage normal stress and negative stimuli, right? And that becomes harder and harder to do over time because it's a self-perpetuating cycle. These microbes are really good at trying to maintain the kind of scenario that works best for them. Even though it doesn't work great for the host, it's working best for them.
And during the menopause transition, our progesterone, estrogen balance, our ratio is not balanced. And so as our progesterone declines as well, we get worse sleep. And when we don't get good sleep, we feel even more stress. So I can see how it is just a really negative loop that we go in and out of every single day.
It is. And the loop is the key term here, right? Because it keeps perpetuating itself and the intensity increases, right? So then what tends to happen is you start to establish this kind of basal level of anxiety throughout the day, right? Because eventually stress will lead to anxiety. That basal level of anxiousness over time leads to a feeling of hopelessness because everything makes you anxious and everything seems kind of doom and gloom. And then the definition of hopelessness is depression, right? So this is how you go into mood balances, issues, low tolerance for things, not being able to deal with the people and the things that you used to normally deal with, all the way to having this basal level of anxiety throughout the day, and then eventually depression. Right.
Yeah, I'm very fortunate that in Chicago, I work with a lot of psychiatrists and therapists in sharing patients and clients because they understand the importance of gut health. They might have to medicate some of their patients temporarily, right? And there's nothing wrong with that. We all need medications at some point in our life. But they do understand the importance of lifestyle intervention and gut health in terms of anxiety and depression.
Yeah, absolutely. And that's fantastic because we've been managing anxiety and depression the same way for almost 60 years
Yeah.
now with very poor results, right? And there is this awesome revolution around the gut brain axis. And that some of that charge is being led by certain psychiatrists, and like Ted Dinan and these really innovative psychologists and psychotherapists and microbiome experts that are making discoveries on how microbes can impact the brain in a very significant way. And in fact, the way you arrest this cycle, right, that we talked about the cycle, and somebody who's in it right now may listen to this and go, okay, now I understand why I feel that way, but like, what can I do about it, right? You can arrest the cycle, and you arrest it actually by, like you said, shifting your microbiome. So starting to bring diversity back to the microbiome, so you can kind of outcompete the microbes that are driving the cycle that want to keep you in that state, right? So you want to have the right probiotic, prebiotic, get outdoors. You want to have a high diversity in your diet. You want to also manage stress on the outside, right? So doing mindfulness work, meditation, exercise, is one of the most powerful things you can do to manage stress. Breathing techniques, all of those things, just throw all of it at it.
Right.
And then on top of that, psychobiotics could be extremely powerful, right? These are probiotics that arrest this cycle by modulating inflammation in the central nervous system. And all of this is perpetuated by inflammation in the central nervous system. So if you have a microbe that can stop this, then you can absolutely, arrest the cycle and start walking backwards the damage and the changes that have happened to the ecosystem, right? So the good thing about all of this is that our understanding of the root cause drivers now is makes it evident that you can reverse almost all of this stuff, which
Absolutely.
is the best
Absolutely.
part about it, right?
Right. Right. And I want to talk about some of your products that I've been using for so many years and that I help guide my clients to use as well. Your total gut restoration program is a 3-month protocol that is going to help bring back your gut health. And I want you to talk about that before we end. And also, you just mentioned your psychobiotic, which is the Zen Biome, which I've started using with a lot of my clients who do experience excessive anxiety and depression, and it's really helped them.
Yeah, those are both really, really exciting products to talk about. So the total gut restoration was a simple approach, right? The most prevalent question I would get from clinicians when I started doing lecturing and all that on the microbiome in the holistic functional medicine space was, how do I know what's wrong with my patients' microbiomes, right? Like I have a patient in the
Mm-hmm.
morning that's a diabetic, and then the next patient is someone with anxiety, and then the next patient is someone with autoimmune disease, and they know intuitively or from reading that each of them have a microbiome issue that's driving the condition. But the big question is, how do I know what's wrong with the diabetic microbiome versus my anxiety patient's microbiome versus my autoimmune patient's microbiome? As it turns out, when you really dig into it, they all have the same thing wrong with their microbiome, right? And this is where that study that I mentioned, the 2015 publication showing that stress-induced leaky gut is the biggest driver of mortality and morbidity worldwide. The reason that can happen is because leakiness in the gut becomes the foundation to virtually any disease, any chronic
Mm-hmm.
illness, right? And it sounds crazy when you think about it, but it's absolutely true, because I think most people who have been following the world of health and wellness are starting to understand that the vast majority of chronic diseases are inflammation based, right? Inflammation is the foundation required for the disease to exist. Cancers and metabolic syndromes and, all these neurodegeneration and even things that we didn't think were inflammation driven, like heart disease, right? Heart disease
Right.
was for the longest time thought to be like a plumbing issue with dietary fats getting stuck in your arteries and so on. We know it's not. We know it's an inflammatory issue, and that's very well established now, even by the American Heart Association. So,
Right.
inflammation is the key, and leakiness in the gut is the number one source of chronic low-grade inflammation. This is why leaky gut becomes the number one underlying driver of chronic disease. So then we looked at leaky gut and go, okay, what's happening there? How is a gut becoming leaky? And it becomes quite simple. There's a simple imbalance of microbes that occurs, and these are microbes, an imbalance between microbes that build and maintain the lining of the intestines versus microbes that destroy and eat away at the lining of the intestines, right? So anytime you have microbes, there's going to be battles between ones that have different outcomes that they're trying to achieve. And in the case of the gut, in the intestines, we have these really important structures on the lining of the gut that makes it not leaky and not permeable. And it's microbes that maintain those structures. And if you get an imbalance of microbes that maintain it versus microbes that destroy it, you'll end up destroying that structure and your gut becomes leaky, right? So we said, okay, first thing is that imbalance. We have to target that. That's where we developed this Megaspore Biotic, which is a spore-based probiotic that brings back the balance. And it does so through a series of quorum sensing, which is reading other bacterial signatures, finding dysfunctional bacteria, competing with them, producing compounds to regrow the beneficial bacteria, so thereby bringing back the imbalance, bringing back into balance the imbalance that is starting to lead to an over diminishing of that lining structure, right? So that's step one in the total gut restoration, is we have to fix that imbalance. Step two is when you start to establish the growth and the presence of the really beneficial microbes that rebuild those lining structures really well, you want to feed them specifically so that their numbers stay high. So we designed some prebiotics that specifically feed these types of organisms. So then that becomes step two in the process, right? Step one, starting to bring back the balance and increasing the growth of the organisms that rebuild the structure. Step two, feeding those organisms to establish their numbers, right? And then step three is providing these organisms with the building blocks of the lining structures, the mucosal lining and all that. We are made up of proteins and certain amino acids. So we put those into the system so that the good microbes now can rebuild the structure and completely alleviate the leakiness of the gut, right? So the total gut restoration is about fixing the microbes, then the structural components of the lining of the gut, and stopping that leakiness, right? So it takes a little bit of time, hence it's a 3-month system. But it's a really important revamp for almost anything. The psychobiotic is really important because what was discovered is that people that have very balanced mood, who have a very healthy response to stressors, external stressors, and people that have very low rates of neurodegeneration tend to have certain types of microbes in their gut that stop and arrest the cycle of stress-induced activation of the neurological system. This is the activation of what we call the flight or fight response, right? So flight or fight response is your basic stress responder in your body, your sympathetic versus parasympathetic nervous system that people have heard about. We know that parasympathetic is basically rest, digest, repair, rejuvenate, right? That's all the good stuff that's happening. Sympathetic is fight or flight, right? And so it's your world exists as a balance between these two neurological systems. Now, if you're someone that's constantly anxious and moving into even depression and have mood issues, you tend to lean towards the sympathetic. You tend to be in fight or flight all the time, right? Which also means you're not resting, you're not repairing, you're not digesting, you're not rejuvenating, right? And so you don't sleep well, you don't assimilate your food well, you can't recover faster from illnesses, you get ill faster. All of these things start to dismantle because you're more so in the sympathetic. Now, what's keeping you in the sympathetic is this activation loop of inflammatory markers from the gut to the central nervous system, back to the gut, and so on. So there are microbes that live in your gut that stop that inflammatory cycle and shift the body back into the parasympathetic. So it can actually change your neurological waves from fight or flight back to rest, digest, repair, and rejuvenate, right? And these are considered to be psychobiotics. So Zen Biome is a perfect example of that, which is an identified psychobiotic that's now, we have something like 10 published studies on it, showing a significant reduction in stress and stress markers when people experience an external stressor, a reduction in all the inflammation associated with stress, a shifting back to the parasympathetic neurological system, and then very excitedly, a change in brainwave activation when you encounter a stressor. And this is a very important note because we have low and high frequency brainwaves. High frequency brainwaves are really important when we are doing really intense work, right? Or we're in sports and we're like really focused and heightened and we need our brain to function really well. If you experience a stressor, an external stressor, and you're in a high frequency brainwave, what tends to happen is the stressor gets amplified, right? Your brain goes into spiraling thoughts and 1,001 scenarios and all that stuff, and you actually just blow up how significant that stressor actually is. There's something called a coping center of your brain that's not actually functioning really well in that state. What you need to be able to do is tap into what we call the low frequency brainwave. That's an individual that's very chill and calm when they experience an external stressor, can think through it, rationalize through it. The things that are within their control, they can take action. The things that are not in their control, they can basically compartmentalize and go, you know what, I can't do anything about that. So I'm not going to worry about it, right? The difference there is, are you dealing with the stress in high frequency brainwaves or low frequency brainwaves? The most well-known way of trying to achieve the low frequency brainwave action is through meditation. That's the biggest, benefit of meditation, is tapping into low frequency brainwaves, but it's quite hard to do. And we have microbes that do that for us. So the psychobiotic can shift your brain waves as well when you encounter a stressor.
Oh, Karan, I could listen to you for 7 to 10 days in a row. I have about 1 million more questions for you. And unfortunately, we're coming to an end. So I'm just going to have you back on again.
Sounds like we need a part 2.
Absolutely. Just incredible information. And I'd also like to say how much I'm really enjoying helping my clients with your well, it's not new, but it's kind of new to me, the biome testing kit.
Yes.
Yeah. And I actually have one of your lead educators coming on my podcast next week, Kara.
Oh yeah, Kara.
Yeah,
Awesome.
Kara's coming on, and we're going to talk about the stool testing, because I think that's another important piece of data for especially menopausal women to gather. What I find in my practice is that with my midlife women, the more data we collect, relevant data, right? Comprehensive blood work with their MDs. I like to look at micronutrient testing to show them you might think you're eating a healthy diet, but you have some gut dysbiosis because you are not absorbing all of the nutrients that you should be. And that's why you're seeing adverse things on the outside of your body, right?
Yep, that's exactly right. Yeah.
And
The old saying of you are what you eat is actually you are what you absorb.
Absolutely. And I just did a podcast with someone over at Timeline Nutrition on urolithin A and gut health and how important that is to mitochondrial health. I always say to my clients, you're only as healthy as your mitochondria. And as we age, they are losing in quantity and quality. And so it's really the magic elixir to good health. And it's all connected. And thank you so much for sharing your time with my listeners today. They are going to have so many golden nuggets here. And I would definitely love to have you back. But for everyone listening, please follow Karan on Instagram. I love your Instagram. You have, as you've displayed today, such an eloquent and passionate way of delivering such highly confusing material and data to non-medical layman people. And that's who we need to reach.
Absolutely. Yeah. Knowledge is power, and nobody's going to be a bigger advocate for your health than yourself. But you can only do it if you have the right information and you understand how all of this works and how your body works. So I really appreciate programs like yours that provides a platform for people to get educated. So it's always a pleasure to be able to jump on and add my 2 cents into their process. So
absolutely. And all of this is going to work so much better if the lifestyle interventions are in place as well. These are not magic pills to take. Probiotics are not magic. You have to layer them on with a healthy lifestyle.
Absolutely.
Yeah. All right. Well, thank you so much again. And I hope everyone's enjoyed the show. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.